Today I am here to talk about laser eye surgery. It has been a topic that has garnered a lot of media attention due to instances of side effects and issues post-surgery. Even The Simpsons have shown the devastating effect of laser eye surgery causing blindness. Today's presentation will be delving deeper into laser eye surgery. Who needs it, what effect it has on our eyes, its pros and cons, and advancements on the procedure to make it more effective and improve its rate of success so we don't end up like Homer Simpson or Ned Flanders. Channel 10 covered the story on SMILE laser eye surgery as an advanced procedure that is now available in Australia. And with this extra media attention, a lot of the audience may be curious on this alternative to glasses. So to start off, what is LASIK? LASIK is a procedure for vision correction. It is refractive surgery that allows for corrections in myopia, hyperopia, and astigmatism. The eye surgery reshapes the cornea, which is the transparent dome structure in the front of your eye. For the surgery, firstly a flap must be created in the cornea. This is done using a microkeratome or femtosecond laser. The flap is then folded to access the stroma under the cornea. The corneal tissue is then removed using an excimer laser. An ultraviolet light beam is then used to ablate microscopic amounts of corneal tissue. This removal of tissue is done to reshape the cornea, thus allowing for an alteration in the light focusing onto the retina. The alteration to the cornea differs depending on the patient's vision. For nearsighted people, the cornea is flattened to increase the light's focal point to the retina, whereas with farsighted people, the cornea is altered to have a steeper curve, thus reducing the focal point of light, making it relatively closer to the retina for improved vision. Laser eye surgery can also treat astigmatism by smoothing the abnormal curvature of the cornea, which would otherwise result in two focal points that reach the retina in different locations, causing distortions in vision. After the reshaping is completed, the flap is then placed back to cover the area where the corneal tissue was removed. It is then required to heal naturally over time. To be suitable, you must qualify all conditions. This will include being over the age of 18 with vision that has not worsened for at least a year, as developing eyes may affect the structure of the eye, making the surgery ineffective in correcting vision. Retina health, eye pressure, and cornea thickness must also be sufficient before the surgery is allowed. Major eye diseases, autoimmune diseases, or a history of eye infections are also critical, as this may cause complications during and after the surgery. As for pregnant women, due to hormone imbalances and the medication being potentially harmful to the baby, it is advised to wait a while after the pregnancy. At this point, you must be thinking, time to throw away the glasses and embrace your face. But before you make the plunge to go under the knife, or rather go under the laser, you must consider the risk associated with laser eye surgery. Firstly, there's a chance that the procedure will result in undercorrection, overcorrection, and additional astigmatism. This means that there's a possibility that the laser will remove too much, too little, or an uneven amount of tissue. Patients must also be aware that there may be vision disturbances, such as difficult night vision, oversensitivity to glare, or halos around bright lights, and even double vision. If these symptoms persist for more than 6 months, additional surgery can be recommended to correct these issues. Other symptoms, such as dry eyes due to a decrease in tear production and problems with the flap created for the surgery, which can lead to infection, may require medication, typically in the form of eye drops. And if you decide to undergo laser eye surgery, you must also be wary of injuries to your eyes, as impacts such as from sports can damage the weakened integrity of the eye post-surgery. So what have been the advancements for laser eye surgery over the years? Firstly, there has been a transition from manual microkeratomes to femtosecond lasers to improve safety through further precision of creating the flap. Eye tracking has also been implemented to enable accurate centration of the treatment. SMILE flapless laser eye surgery has also been gaining attention due to its advancements. It is fundamentally very similar to LASIK, except a smaller keyhole is created for surgery rather than a larger flap. Of course, this means there's no flap-related complications, mainly preserving the strength of the cornea by allowing ablation of weaker, deeper tissue rather than the stronger front corneal tissue. This procedure also has the benefit of being available to patients with more severe prescriptions. Although since it is a fairly new procedure, further surveys of patients post-surgery will allow us to understand whether there is a more biomechanical strength in the eye in the long term by using the SMILE procedure. So overall, for people looking for laser eye surgery, LASIK is widely available, with SMILE being a more advanced alternative. Although the likelihood of complications are low, patients should keep an eye out for infection, trauma to eyes, and any complications post-surgery when deciding to undergo laser eye surgery. Hopefully this has cleared up a few things about laser eye surgery. See you next time.